Hello cruel world, my name's Dr. Sohom and I'm a Consultant Forensic Psychiatrist. I regularly assess patients in courts and prisons and in secure psychiatric units. This video is about how I deal with aggressive and violent patients. The reason I've chosen this topic is firstly because I think it's actually very fascinating, but also because a couple of people have reached out to ask specific questions about this. And they are Flix, who asked me when I see prisoners whether they're handcuffed, and if not, whether I'm scared. And also Joanne Dawson, who emailed me asking about restraints, so physical restraints in high secure units, including straitjackets, whether they're used, etc. So I'm going to answer those questions and more in this video and the next. So the first thing I want to say is that the vast majority of psychiatric patients are not violent. I think it's incorrect to assume that they are, and it adds to the stigma, which I definitely don't want to do. Having said that, I specifically work with mentally disordered offenders because I'm a forensic psychiatrist, so I'm very aware that my patient kind of group is skewed towards violence. The other thing that I think is only fair to say, even though it's not particularly that glamorous, is that even though patients have often committed very serious offences originally, including murder, often by the time I've seen them, they've calmed down because it's been several weeks or months. So the person in front of me is more often than not relatively secure and stable. I've split this topic into two videos. So this video is about the people that I see in prisons and in courts. So technically they're not patients, they're defendants, because at that point they haven't been diagnosed or detained under the Mental Health Act. And my second video is going to be about patients. So it's going to be about violent patients in secure hospitals. And they're very different because the ones I see in prisons and courts, I'm just seeing them as a one-off for a quick assessment, so I can write a report for the court to help the judge in terms of deciding how long they should go to prison, etc. Whereas the people that I assess and treat in a hospital have been, firstly, they've been diagnosed with a mental illness, but also they're there for long-term treatment, could be years, even decades sometimes, to decrease their risk. So the way that you deal with them obviously is very different. Okay, so let's start with prisons. So I would say that the vast majority of the time when I assess prisoners, they're on their best behaviour because they know that I'm there to write a report for the court. So they think that if they make a good impression, then it's likely to help their case and the judge is possibly going to look on them more leniently. Sometimes the prisoner is disinterested, so either they don't care about the outcome of their court case or they see me as part of the system and therefore the enemy. But to be honest, they're usually passively aggressive or rude. Occasionally they might swear at me. It's very rare that they're physically aggressive because there's no benefit to them. They don't gain anything from physically attacking me. There have been exceptions. Generally, the exceptions are when prisoners are so psychiatrically unwell that they literally just can't contain themselves, so they can't control their symptoms, or they have no insight, so they don't even know that they're acting in a particular manner. On the odd occasion where I do see very agitated or violent patients in prison, it's usually either in the segregation unit, which is kind of like solitary confinement, or in the healthcare unit, which is kind of like a psychiatric ward inside a prison. The difference being that people in the segregation unit are there for punishment, where in the healthcare unit, they're there for treatment and there's doctors and nurses that observe them regularly. If somebody in either of those places is extremely agitated, then sometimes I do the assessment through the hatch. So they literally open like the door a tiny bit and I speak to them through the door. Now, obviously, this is not going to be a particularly detailed or thorough assessment, but to be honest, when they're that agitated, it's just a matter of whether they need to go into hospital under the Mental Health Act. And that's a fairly easy decision to make if they're that agitated. And then once they're in hospital, they can be medicated, calmed down and assessed more thoroughly. There isn't that much point in forcing and pressurizing somebody who's that agitated to sit in a room and talk with me, because it's very unlikely I'm going to get anything particularly helpful out of that assessment, and it's just going to stress them out. So a few months ago, I saw a woman who was in the healthcare unit, completely psychotic. She was smearing feces on the wall, she was screaming and shouting about the devil, she was spitting at people through her little hatch in the door. So I spoke to her briefly through the gap, but again, I wouldn't have got anything by forcing her into a room. She might have attacked people, it wouldn't have ended well. Sometimes I see patients on a 1-man, 2-man or 3-man unlock in prison, which means that they're so dangerous that either 1, 2 or 3 prison officers have to accompany them every single time they're out of their cell. Again, these are usually quite brief assessments because the patients are so agitated. The most extreme case that I've personally dealt with was several years ago in a young offenders institute, and there was a man very young man, who was 18 I think, who had autism, who was extremely violent, and he was on a 7-man unlock, which is almost unheard of. So by the time I went to assess him, he was sitting at the far side of a room with a big table in between us and 7 prison officers in the room. And occasionally he sort of got up, and every single time he moved, the officers kind of pounced on him and just pushed him down. They weren't, heavy-handed. The interview only lasted about 20 minutes, and then he himself was getting agitated and he wouldn't sit back down. So they asked me to leave. They terminated the interview. They restrained him and put him back to his cell. But again, that's the only time that's happened in my career, so that's not the norm. Most assessments that happen in prison, I see the prisoner in the legal visits area, and it's usually you get your own little room with these big windows so that the prison officers can look into them, and there should be somebody there kind of observing all the assessments. In reality, it kind of depends on the prison, depends on how short-staffed they are. Some prisons are very good at it. Some prisons, you barely see the staff after you've gone into the area. And every room has an alarm, so if you press it, then the prison officers are alerted that there's an emergency and they should run in. I've never had to press an alarm in a prison. I've been in a situation where a prison officer has pressed an alarm, and this was because I was, for reasons I don't understand due to prison bureaucracy, I was kept waiting for 2 hours after the allotted time for me to assess a prisoner. And by the time I actually finally got let in, there was only 15 minutes left of the appointment, and the officers had no flexibility. They wouldn't let me stay. So this prisoner, who was mentally unwell, understandably got really upset. He kind of kicked off, started shouting, banging on the tables. He wasn't really directing his anger at me, it was more at the prison itself. Officers came in, pressed the alarm, loads more officers came in, restrained him, bundled me out. That was the end of the assessment. So to answer your specific question, Flicks, are prisoners handcuffed when I assess them? No, they are not. I think that might happen in the States, but it doesn't happen in the UK. If a prisoner is deemed to be risky enough that they might need handcuffs, then in the UK they would either be seen in their cells with the door open slightly, or they would be on a 1, 2 or 3-man unlock. And am I ever scared? The answer is no. I fear no man and I fear no thing, except for maybe having to tidy up, which my wife makes me do once in a while. In terms of defendants that I see in court, generally they're usually in custody cells which are like below the court, so you have to go down some stairs. This is not that dissimilar to seeing them in prisons, really. Sometimes they're handcuffed when they're being transported between the cell and the interview room. I'm not sure why, it just seems quite common, although they're not actually handcuffed when I speak to them. And I have to say, generally I feel a little bit safer in courts than I do in prisons. Not that I feel particularly unsafe in prisons, but in courts, I think it's the fact that it's like a smaller enclosed space. There seems to be more staff available, there's more gates that you walk through, and it just seems like a bit of a quieter, calmer environment than prison. It just feels more contained. And it depends on the courts as to the arrangements of me assessing them. So sometimes I'm sitting literally in the same room as them, again with big windows so that the court officers can look in. Or sometimes there's a big partition, so there's a big glass window, and I come in one room and they come in through a separate door into another adjoining room. Obviously in that situation I feel very safe because they physically can't get to me. The other thing that I should mention is that the furniture is all bolted down, so the tables, the chairs are all bolted down, and very frustratingly the chair always seems a bit further back than is comfortable, so I'm always kind of leaning forward trying to write notes. I don't know why that is. I can only assume that it's adapted for the more rotund assessor that comes into the courts. What I'm trying to say is all barristers are fat. And again, generally speaking, the defendants are on their best behaviour because, again, I'm writing a report for the court for them. And again, if they are particularly agitated, then I might see them briefly at the door, at their cells inside the court with the door slightly open. And again, I don't force a long assessment because there's no point. I can actually get more information about their mental health and their mental state from other sources. Speaking to family members, speaking to previous psychiatrists who have treated them, looking at their medical records, etc. Okay, I'm coming to the end of my video. Next video is going to be similar, but it's going to be about how I deal with aggressive patients in psychiatric hospital. It's actually very different because we're actually treating their violence as opposed to seeing them in prisons and courts where it's just a quick snapshot to report to the judge. Before I go, I just want to formally welcome you to this channel, A Psych for Sore Minds. I'm a consultant forensic psychiatrist. I live and work in London and I assess defendants and patients in courts, prisons and psychiatric units. I also work as an expert witness to advise the courts. This channel here is like a crossroads between true crime and mental illness. And I cover a whole range of topics, some related to offending and violence, like this one, and some that are more familiar to the average person. You should go and check out some of my videos. There's a whole kind of eclectic range. Sometimes I discuss individual diagnoses. Sometimes I discuss high-profile true crime cases where the perpetrator has got a mental illness. Sometimes I talk through the medico-legal aspects of what went down in court. But my USP, I think, is that I actually talk in some videos about my real-life cases to try and educate you guys. I obviously anonymise the patients out of respect for their confidentiality. So you need to subscribe. Not only will it help me out immeasurably, but subscribing actually makes you a little bit taller. Unless you're too tall, in which case it makes you a little bit shorter. But if you're the perfect size, then very little happens. Anyway, take care of yourself and I'll see you next time in A Psych for Sore Minds. And remember, I love you.